Good morning. My name is Farhan Hafiz. I'm from the Sport Medicine Quinto. So today I would like to discuss about the Achilles tendon rupture. Achilles tendon is the most common tendon ruptured in the lower extremity. So most commonly it will occur during the third until the fifth decade of life. So prevalency is happen more to the male compared to the female people. So for the acute ruptures, it's often present with a sudden onset of the pain, associating with the pop sound can be heard from the local area. And then patient usually come to our clinic with describing the describing as a have a people kick at the particular area. So we talking about the mechanism of the trauma is a sudden onset or sudden force of the foot towards the plantar flexion position. Other than that, it can be happen because of the direct trauma. Okay, what is the type of the sports can be happen in the Achilles tendon rupture is like basketball or athlete with involving the track event, and also the tennis. Other than that is volleyball. So for the risk factor for the Achilles tendon rupture, it can be happen because of the poor conditioning of the body before the exercise. And then Achilles tendon is the most by the definition of the Achilles tendon is a tearing and separation of the tendon fiber, so that tendon can no longer perform its normal function. The most common site happen is 2 to 4 centimeter above the calcaneal insertion of the tendon. Why 2 to 4? Because there is we call as a gray area, which is the means it has a poor flow vascularization. I mean the poor blood flow in the particular area. Okay, so like I say, the mechanism is because of the sudden forces plantar flexion of the feet, and then the risk factor is other than the risk factor is because of the athletic activity itself. Can be happen also because of the prolonged use of the corticosteroid, overexertions, and then history of use of quinoline antibiotics such as the fluconazole. Okay. Other than that is a systemic factor such as a patient having a disease with parathyroid disorder or thyroid disorder, chronic renal failure. Other than that is diabetes itself. Okay. It can be happen. Risk factor also can be happen for the foot problem itself, such as the patient having cavus feet or insufficient gastrosoleus flexibility, and also the strength, and then limited ability to perform ankle dorsiflexion, and then also the varus alignment with functional hyperpronations. So classification of the Achilles tendon rupture, we divided into two. There is a complete rupture. It's the most common the classification we can get, and other than that is partial rupture. And then another one is avulsion fracture of the bony insertion of the Achilles tendon itself. So normally for the clinical presentation, patient will complain of the sudden onset of pain at the Achilles tendon site, associating with the popping or snapping sound, and then suddenly loss or reduced plantar flexion power. Also, we can notice there is a deformity at the Achilles tendon, and then from the palpation we can palpate there is a disruption or interruption of the Achilles tendon itself. So for the test we can do for Achilles tendon rupture, we can check whether the Thompson test is negative or not. by the squeezing the cuff of the gastrocnemius. We prone the patient in the we position in the for the patient we position in the prone position with the leg extended, and then we slowly squeeze the gastroc to see whether there is a plantar flexion occur or not. That means if the test is positive, that means no movement plantar flexion of the foot. That is the Thompson test. The other test we can do is we call as a hyperdorsiflexion test or Mattels test. In this test, we prone the patient, and then we ask the patient to flex the knee 90 degrees, and then we slowly put the pressure at the foot towards the dorsiflexion. So normally, if the positive test, the dorsiflexion will be more towards the normal leg. Okay. Okay. For the diagnostic, we can usually the Achilles tendon rupture be diagnosed by clinical, but for the supportive diagnosis, we can do the ultrasound, either ultrasound or the MRI. Okay, so we can for the MRI we can monitor, we can get to know whether this rupture is partial or complete. So normally for the treatment of the Achilles tendon rupture, it can be divided to two, surgically and conservative. For surgical, we can do the operation, either than the open repair or percutaneous tendon repair. Possibility of the quicker return to work with operation intervention, but we can. But for the surgical management, it have a high complication rate compared to the non-surgical. For non-surgical, we just do the rest, icing the leg to manage the swelling, manage the pain, put the functional bracing, and then okay, for the non-surgical, is a lesser complication compared to the surgical management, but it higher chances to get the re-rupture of the tendon. Okay. So for the rehabilitation, both management will require for the rehabilitation program. So for the prognosis of the Achilles tendon rupture, the prognosis usually is good, but in some non-athlete there may be some residual deficit, like for the reduced range of motion. And then for the non-surgical treatment, the prognosis, chances to get the re-rupture of the tendon will up until 40%. And then if the patient managed by surgical management, the prognosis complication to be re-ruptured is only up to 0.5%. So for the prevention, the athlete or the person must have adequate warming and also the stretching before the physical activity started. Okay, that's all.